Our plus one today is transforming patients from all around the world every day at his Beverly Hills practice, making his grand return to talk to us about the latest trends in aesthetic medicine is Dr. Daniel Gould. Thank you once again for being here.
Thanks for having me.
This is fantastic. What do you want to start with? I mean, what are some of the trends that we're seeing?
Well, there's all kinds of trends going around.
What's the big one right now?
Right now, a lot of people are talking about facial results and what you're seeing kind of in celebrities and in the media.
Kris Jenner, right?
Yeah, and there's a lot of talk, and I think, you know, everyone's talking about results, but I don't think it's fair as a surgeon to actually comment on the quality of outcomes based off of just a few photographs that you've seen. So I've really stayed out of the debate because I don't feel like it's ethical for me to sit there and say, you know, hey, this is a great result or a bad result if I haven't seen the patient before and after.
Well, for anybody who doesn't know, like, what the controversy is all about, there was a rumor, I guess, I don't even know how it started, online that she was not happy with her $100,000 facelift by Dr. Stephen Levine. I believe he's in New York.
Yeah, a great surgeon in New York.
Right.
No, but initially she was happy, right? Because we all saw the pictures.
Well, yeah.
And then now,
but there were reports that she wasn't, and then she went on her daughter's podcast to set the record straight and to say, no, I'm actually thrilled with him. I love the work that he did. So where did that, do you even know where that started?
Yeah, well, I mean, honestly, what it comes from is people are seeing photographs of her and commenting on what they saw. And again, it's kind of unfair to comment based off of what you see from photographs that are out there. But the reality is that I think what really triggered people in this story was people were thinking, what if I had a surgery and I had a facial surgery or plastic surgery and invested all this time, resources, and energy into an outcome, and then I was unhappy? And that's really what resonates with potential patients and people that are seeing this in the news, because they identify with her as a celebrity that they love and they care about, and they think, what if I was going through that kind of thing? And selfishly, people are thinking about their own experience. So what would happen if somebody, and I'm not saying that she was unhappy, because clearly she's very happy. She came out and made a whole, you know, discussion about it with her daughter. Yeah. But if someone is unhappy with the result, that's the real question. Where do you go next? Because the truth is, no surgeon has a practice that's full of all happy patients. I have unhappy patients. Surgeons across the U.S. that are amazing surgeons have at least a handful of patients per year where they're not living up to the expectations of that patient. So what happens next? You've invested time, energy, and money. Most surgeons have a revision policy where they say something like, I'll take you back and try another surgery to get the result, to get you where you need to be. And in my practice, that doesn't involve a surgeon fee, but there's a small fee for like OR and anesthesia, very nominal. And then the surgeon can potentially address issues like if the facelift has dropped, or if it's slipped, or there's been some kind of secondary.
Well, how long should you be waiting before you come back and...
At least a year. And I tell my patients that up front. I say we want to wait until 6 months to start looking at results. 9 months we're making a decision, so at 1 year we could reoperate. Because if there's still healing going on inside and you intervene too early, there could be bigger problems. And when I see revision patients from other surgeons, I talk with them about this because they're upset, the result doesn't look the way they thought, and they're only 3 months out. I say, look, you've got to give it time to heal. And it's unethical as a surgeon to intervene too early because you know it's a moving target. The train has left the station but hasn't gotten to the destination. So if you jump off too early, you're going to wind up...
You could probably make it worse too.
Much worse, and you could wind up with a result that looks good initially, but then since it was still healing, we'll end up in a place that you don't want it, in an unnatural or strange look in the end, which you're trying to create the most natural result.
And is there too late? Like if you act too late after a year?
After surgery? No, I think the longer you wait, the more it's healed on the inside. And when I do revision cases, or let's say secondaries, where they're 10 years out from their first facelift, it looks a lot better than if they were only 2 years out. It's healed enough where the materials, the quality of their tissues inside are good enough to have a great result. I just did one on Tuesday where she was 12 years out from a previous facelift, and we just went back in, and it was really nice on the inside. It was well enough healed where we got a fantastic result on the table.
Going back for a moment with the Kris Jenner pictures, because I think also you have to take into consideration when you see some of these pictures, the lighting and the filters and the makeup, and you know, you have to think about that because there is a little bit of that
that goes. Fair, a lot of that filtering happens on their own personal pages.
Of course.
We of course filter our own photos.
But when you have someone like Denise Richards, who then releases like actual medical grade photos, and you have that comparison. Speak to that.
Well, and Ben Talley, another great friend of mine, fantastic surgeon. The nice thing is that he gave the medical grade photography to people to use, and medical grade photography shows a patient in different angles, in similar lighting, similar background, almost identical, maybe a little bit of light makeup because it's hard to get patients to take it all off when they come to see you 3 months out. They're like going to dinner, it's hard to take it all off. But in those views, you can actually see the angles that you need to, how the jawline actually looks, how the eyes actually look, similar lighting, because we know lighting makes a huge difference. I saw a really interesting Instagram post about finding your lighting by one of these movie stars, and I was thinking the whole time, find a great facelift. But my friend Ben posted those photos, and his results are great, but he also, then you could walk down what you saw. Now, plastic surgeons are trained through our certification process to utilize photographs in order to study results. So part of our training and our board certification is we go to a room, they show us photos, and we tell them what happened or what should happen. So photographic analysis is part of the natural training for plastic surgeons, American board certified. So you should be able to look at well-taken photos and say what happened. But that's another example of you know, how photography can show you what really happened. But still, if you haven't seen her in person, Denise Richards, if you haven't seen her in person, I still think it's wrong. And I think as a surgeon, as a plastic surgeon, I haven't commented on any of this on my socials because I feel like it's not really the place to analyze another surgeon's results. Like, if the patient's happy, the results are good, the surgeon's happy, why is there even a need for a conversation? It's silly.
Do you approach every patient with ethnicity differently? Is it difficult? Because, I mean, I go to a special place that can cut Asian hair, right? Or Asian makeup is different than someone else. So is it difficult as a surgeon?
Not really. I mean, again, my technique focuses on looking at the anatomy on the inside and putting it back where it was. So ethnically, there are differences in the anatomy, but as long as you adhere to that roadmap inside, you're likely to create a result that's congruent with their ethnic background. You're unlikely to change or remove the ethnic traits that they find beautiful. But you should also talk with your patient about those because, for instance, within the Asian community, there's a big focus on Asian eyelid surgery and changing the way that your eyes look. And there are surgeons, that's all they do, you know, 10 times a day. I recently referred a friend to another surgeon who that's all she does.
It's huge in Asia.
Yeah, and that is the kind of surgery where if you're looking for a change that's going to alter the ethnicity, then you need a surgeon that's specifically focusing on that. Again, I'm an anti-aging surgeon. I look inside at the anatomy, put it back where it was. So it's a little different. I'm, again, not trying to change their ethnic identity, just make them look like a better version of themselves.
One thing that kind of gives me hope, speaking of better version of yourself, is like there's this migration now toward more natural looking features and retaining your own natural face as opposed to the fillers that we saw maybe, what, 5 years ago, 10 years ago?
A big paradigm shift. And actually, I was just mentioned in an article by Elle this week where they quoted me as saying naturalization of the facelift is like the biggest boom that we're seeing. I actually have patients coming to me who want to look more natural. They had previous surgery and we're trying to fix it to bring them back to their natural anatomic set points on the inside. We want to have more natural results because they look better. I was listening to the radio on the way here and they were talking about different celebrities and how great they look. And the person on the radio was saying, you know, they look like a normal version of themselves, not an alien. And then the other person was saying, well, the fillers in this is probably what created that alien look in that person many years ago. And I think that what we're realizing is that, you know, in the past we thought a lot about aging as volume, the loss of volume. So fillers were a good choice to add volume, but it gets carried away. And then you realize that was because they couldn't really lift and they didn't really know how to move things on the inside to put them back in a natural location. But now we've progressed so much in facial surgery and anti-aging surgery with anatomy that we can actually see those anatomic ligaments and put things back where they belong. And instead of overcompensating for a poor lift with volume, we can actually lift appropriately and make it effortless.
Stick around. We're not done. We'll take a break. We'll come back.
Great.
I want to ask you about GLP-1s.
Oh my gosh, yes.
Yeah.
Oh, wow.
Big one.
Yeah.
Okay, continuing our
we were asking
conversation.
about GLP-1s and how it's changing people's faces. I came across recently a picture of Olivia Wilde, and she's a beautiful woman, but I don't know, this one picture, her eyes looked like bug-eyed, and she's lost a lot of weight. And so for me, when I'm looking at a lot of pictures of people, I feel like people are taking weight off and then trying to fill areas where the weight's been taken off because there's a hollow area now by the, you know, the cheekbone or the near the eye. And there's this constant like taking off, putting back on, taking off, putting, what is happening?
Well, yeah, without talking very specifically about celebrities, because again, I don't know her and can't really comment on what she's doing, I would just say that in my practice, I see patients that are on different medications, including GLP-1s, that dramatically affect their body and face. The issue is you want to lose weight, and it's healthy to do that. But I want to actually dig a little bit deeper, because think about the psyche behind, and I'm talking not people that are doing it for 10 pounds, but maybe people that have lost 40, 50, 60 pounds. You think about those people, okay, the psyche behind what caused them to gain weight. Right? And then you move that into the world of GLPs and what causes them to take it overboard. It's the idea that like it's never enough.
It becomes
right?
like a dysmorphic kind of situation.
It's more than that. It's psychological. Like to gain that much weight, the massive weight loss patients, they have this feeling of like it's not enough, and that's why they consume. And then they use the medication, they can go overboard the same way. If you talk to psychologists and psychiatrists about how the medications work and how they're working, it can be a drug of abuse in people who have issues, psychological issues that led to the weight gain. And same thing with the plastic surgery that comes afterwards. Because I see that a lot in my practice where they've lost 150 pounds, fantastic. They want surgery to make their body look better. We remove extra skin, great, they look great, and now they want to look better. It's like they want more, right?
So you success is a horizon, like you never quite get there.
These patients are going to have at least probably 3 surgeries to address massive weight loss like that, because you have to do it in stages for it to be safe. But then to keep going, like you're doing 6, 7, 8 surgeries on somebody, it's a little excessive. And as a doctor, as a surgeon, you have to be able to sit someone down and be like, what are our goals? What's achievable? What's realistic? What kind of body type can you achieve? How do we do this safely and not take advantage of your situation?
But I think also what you're seeing with people who are on GLP-1s is like a hollowing out of the face, right?
Hollowing out of the face and body. So the face has facial fat compartments that are just as susceptible to weight loss as the body. And some people lose facial fat quicker, earlier, at an earlier age. It's a genetic predisposition, how your facial fat is going to change. But something else happens with GLP-1s. Remember that the GLPs reduce your body fat composition and percentage, and the fat stores important vitamins, A, D, E, and K. And vitamins A, D, and E are super important for the skin quality. It's not just the facial fat, it's actually the skin quality. So we see changes in skin quality, loss of volume in the fat compartments, and changes in the fascial network that is below. There are also changes in the glands, like the glands that produce the heaviness in your neck and the parotid glands, because they produce saliva to eat food. If you're eating less, some of the salivary function goes down. So you also see hollowing in those areas too. And there are new medications coming soon that will also target those specific types of anatomy of the face. So you're not just seeing a collapse of the facial fat compartment, changes in the glands, changes in the skin, changes in the fascia, and somewhat changes in bone quality too, because there are other important changes that occur.
How do you address that then? How can you reverse those?
It's not simple. It's a very complex process. First you lift and add volume, and then you improve skin quality. So in my practice, I focus a lot on the last part, because a lot of facial surgeons are lifting and adding volume with fat transfer, but skin quality is the untapped, like, excellent piece. That's like, if you put your cheek back up on the bone, it could look 20 years younger. If you add volume from 20 years ago, it can look better. But improving the skin quality so it looks like the skin you had 20 years ago makes it all tied together. If not,
what do you do there?
So we do a series of different things. Nano fat transfer is the use of stem cells and growth factors from your own fat that we take and harvest, purify, and then re-inject into your skin using a little channel, a micro channel that allows us to inject it tiny little amounts into the skin. We also inject it with a cannula into areas like the tear trough and into the lips to improve the blood flow to the areas, to make a pinker lip, less vertical lines, and more moisture content. We also use a topical medicine that I prescribe. It comes from a pharmacy. It's not cosmetic, it's not expensive, it's $60 for 3 months worth. It's retin A with hyaluronic acid to balance the drying effect, niacinamide to improve the barrier function of the skin, vitamins D and E which improve skin cell membrane as it goes through turnover, resveratrol, an antioxidant, turmeric, and anti-inflammatory. Sorry, it's a lot. But
you have a prescription book with you, right?
That's right.
So we treat the outside of the skin too, right? And then we use a CO2 laser and microneedling and specialized forms of microneedling with exosomes and other products. So I am going full bore, like all out on the skin, because I know that I can do a fantastic lift, I can add volume, but if I make your skin glow afterwards, that's what people see and they say, whoa.
What you just described, how long is that process?
To improve the skin quality?
Yeah.
Well, I start them on topical medicines prior to surgery, and then we do the surgical event where I do a CO2 laser. But then afterwards, I do another laser and additional topicals throughout the process up to 3 months. And now in my practice, I do secondary fat transfer in almost all patients at 1 year post-op, which I want to explain in a second because it ties back into the first question. What if you're unhappy? The main reason people are unhappy after this type of surgery is loss of volume. They look great when they're full, when they have great volume in their brow and their cheek and their jawline. Swelling happens and then they miss it. And you can come back at a year and do a better job of fat grafting because you're not doing surgery at the same time. Less inflammation, better blood supply to that fat, overall better results. So I tell my patients, we're going to come back at a year and revolumize, further improving skin quality again with another treatment of your own stem cells.
It's fascinating.
Wow, when are you coming back?
Yeah.
When do you want me?
Part 4.
I know.
I feel like we always get close.
I know.
Your schedule. You're the one doing all the surgery, so let us know.
You're the busy one.
Well, in the meantime, Dr. Gould can be found at drgouldplasticsurgery.com and on Instagram at Dr.Gould Plastic Surgery.
Thanks.
All one word.
Yeah.
Amazing.
Thank you. We'll see you next time.
So.